dissection is now to find out the possible cause of hearing loss, because we have found out the presence, the type, and the amount, and the idea is to look into the ear by using the technique of what we call otoscopy. Now, otoscopy uses an otoscope. This otoscope is generally has a speculum, and it's supposed to be held in a particular way, which I will demonstrate to you. And once you look inside, remember, we are only placing the otoscope in the external auditory canal. You're not supposed to insert it so deep that you cause damage. Gentleness is the hallmark of successful otoscopy. So, when we look inside, this is what you're supposed to see, which is the tympanic membrane and the external auditory canal. So, I would like now to demonstrate to you. This is our otoscope. And the first thing is, of course, you test whether it works. So, in this case, it's working. You must always use spirit to clean the speculum before and after every examination. So, you clean it and you hold it like a pen, like that. You don't hold it like that or like that. You hold it like a pen. And this little finger of yours, you'll see it has a very important duty, which I will demonstrate to you. So when you're examining the right ear, you have to hold it in your right hand. The first thing you do is that you place the little finger on the cheek, so it becomes your fulcrum, and then the pinna is pulled gently upwards, outwards, and backwards to straighten the canal, and then under vision you advance the speculum and look at the external auditory canal and the tympanic membrane, both of which are usually very clearly visible. The patient should be no pain and there should be no tension at all. That is the correct examining position. Once you have examined that position, you have demonstrated, you immediately clean your speculum. You never mix the two sides, because you may introduce infection from one side to the other. And if I may demonstrate to you, you then change hands. Left hand for left ear. Again, like a pen, same technique, make a fulcrum, pinna upwards, outwards and backwards, and then you introduce your speculum gently and gaze at the external auditory canal and at the tympanic membrane. You may identify wax, you may identify inflammation, you may identify foreign bodies, and that is the value of otoscopy. Otoscopy then completes the assessment of hearing, and by that time you should know, does your client have hearing loss? If he does have hearing loss, what type of hearing loss? Is it conductive, sensorineural, or is it mixed? You should also know, is it possibly, what is the amount of hearing loss? Is it mild, moderate, severe, or profound by audiometry? And finally, you will look in the canal and try to identify the canal and the tympanic membrane. You may identify wax, you may identify foreign bodies, you may identify a hole in the tympanic membrane. By then, we have a complete diagnosis about the presence, type, amount, and cause of hearing loss. Thank you very much. Thank you to Mr. Zivo for being our subject.